And golfers can have all kinds of injuries. And the reason being is that there's a chain that comes from the floor. So when they're exerting the strength to be able to hit the ball, the force comes from the ground. So it goes through the foot, then the knee, then the hip, then the core, and then the shoulders, and then it goes through the hand, through the club. So it's basically a force that runs through the body all the way down to the ball. And in that motion, there's overuse injuries that can happen, for example, in the Achilles, in the elbow, or in the rotator cuff. There's some injuries that can happen in the knee, in the meniscus, in the cartilage, and also in the hip when you have something called femoroacetabular impingement. That is when basically the ball doesn't fit the socket very well. That motion is going to be impaired. So all those things can lead into injuries and overuse injuries as well. There's an article basically saying that 1 out of 2 people will have an injury within the time frame of 2 years. And 90% of the people that have played golf for over 10 years will have some sort of overuse injury or any acute injury based on how they hit. So we take care of every type of athlete, from a weekend warrior to a professional athlete, and we usually take care of joints or muscle injuries or tendon injuries. That means if you have a knee injury, for example, in the meniscus or the ligament, or a shoulder and rotator cuff, if you have a labral tear in the shoulder or in the hip, those are the kind of things that we actually treat. And we usually treat, also treat things like, for example, muscle injuries or tendon injuries that might have been type of overuse injuries. And those are the things that we help athletes get back to what they love to do. So as you said before, we have 2 different teams to treat, a comprehensive array of pathologies. And I'm a sports medicine surgeon, which means that we try to preserve the joints. We do all joint preservative techniques, which means that we don't do replacements of joints. We try to keep those people with their own joints and their own tissue. And for that, we provide several procedures that we can do to try to avoid that from happening. Of course, the sooner they come here, the more chances we have to work with that joint to be able to preserve it, which has a lot of advantages, such as having mechanical receptors that basically allow your knee to know exactly where they are and avoid injuries. And it feels more normal. It feels like your own knee because it is, right? When you have a knee replacement or a hip replacement, although it's a great procedure for pain relief, is not as good for those people to get back to high impact type of activities. Whereas if you have your own joint, you can still do that. So I think it's critical that we see those patients in a timely fashion to try to avoid having a knee or a hip replacement down the line. So there's 2 things that I would say. One is that they need to warm up. Usually golfers are not very good at warming up and they just start playing. So walking and doing the motions before they start, just to get that body warmed up, the shoulders, stretching out the shoulders, moving their knees. A good 10 to 15 minute stretch before and after the game will allow them to be in really good shape at the time of the game. The second thing is that if they have a nagging pain, most athletes would not go to the doctor soon enough, so they will just keep going, take anti-inflammatories, sometimes do some stretches that they would see on YouTube or read in Google. So those are the things mainly now at the end of the season that we would encourage them to do. Just go to a doctor, get an MRI. It's been a pain that has been nagging for 3-6 months, because there might be something that we can fix and allow you to get back safer and stronger. The problem is that sometimes those muscles get so deconditioned from not being used or being torn that sometimes the outcomes are not as good when you treat them acutely. So that's why it's important for anybody that has a nagging pain that has not subsided with conventional non-surgical treatment to come to the doctor and get an opinion.